It's 3 o'clock in the morning. The house is quiet. You're not sure what woke you up. But here you are, awake again. Your body feels tired, yet your mind feels alert, maybe even uneasy. And you quietly ask yourself, why does this keep happening to me? If you're over 60 and this sounds familiar, please stay with me. Because tonight, we're going to talk about why this happens and why it's not your fault. If you're watching this and you're over 60, I want you to know something important right away. You are not broken. You are not doing anything wrong, and you are certainly not alone. Many seniors wake up around 2, 3, or 4 in the morning. Some feel restless. Some feel anxious. Some just lie there wondering why sleep won't come back. And that quiet frustration can feel heavier than the sleeplessness itself. But take a slow breath with me. There is a reason this happens. And once you understand it, the fear begins to soften. Doctors often point to one main reason for these early morning wake-ups. It's a hormone called cortisol. Now don't worry, this is not something dangerous by itself. Cortisol is actually a natural, helpful hormone. Doctors sometimes call it the body's gentle alarm clock. Its job is to help you wake up in the morning, regulate blood pressure, and keep your body steady. But as we age, the timing of cortisol can change. And in many seniors, it starts rising too early, around 3 a.m. In a moment, I'll explain why that happens. And more importantly, what helps calm it naturally. Understanding cortisol and why it rises at night. To truly understand why waking up at 3 in the morning is so common for older adults, it helps to first understand what cortisol actually is and how it behaves inside the body. Cortisol is a natural hormone made by the adrenal glands, and it plays an important role in helping the body respond to daily life. It supports blood pressure, helps manage blood sugar, and prepares the body for gentle alertness when morning arrives. Cortisol is not a harmful substance. In fact, without cortisol, the body would struggle to function properly. A helpful way to think about cortisol is to imagine it like a dimmer switch on a light, not a simple on and off button. During the daytime, cortisol slowly rises to help you feel awake, focused, and able to move through your day. As evening approaches, cortisol should gradually lower. At night, it is meant to stay calm, quiet, and resting, allowing the body and brain to drift into sleep and remain there for several hours. In a younger body, this dimmer switch often works smoothly. Cortisol stays low through most of the night and begins to rise closer to morning. However, for many older adults, this timing begins to shift. The body becomes more sensitive to signals from the environment and from inside the mind. Stress from earlier in the day, physical discomfort, or even gentle worries can cause the cortisol dimmer switch to turn upward too early. When cortisol rises around 3 in the morning, it can feel as if the body suddenly decides it is time to be alert. The eyes may open without warning. The mind may feel clear or busy, even though the body still feels tired. This experience can be confusing and frustrating, especially when it happens repeatedly. Many seniors worry that something is seriously wrong when this occurs, but this reaction does not signal danger. An early rise in cortisol usually means that the body is being overprotective, not broken. As people age, the nervous system often becomes more cautious. It responds more quickly to small changes, such as a shift in breathing, a mild ache, or a passing thought. Cortisol rises as a way of preparing the body, even when no real threat is present. Doctors often explain that this is a sign of a body that is trying very hard to keep you safe. For many seniors, simply understanding this brings a sense of relief. Knowing that waking up early is not a personal failure or a serious illness can reduce fear. Fear itself can raise cortisol further, creating a cycle that makes sleep more difficult. When fear softens, the body often responds with more calm. This understanding lays an important foundation for what comes next, because aging affects sleep in specific and predictable ways that are important to recognize. Why aging changes sleep patterns naturally. As the body grows older, sleep naturally changes. This is not a sign of weakness or decline, but a normal part of the aging process. Deep sleep, which is the stage where the body repairs itself most deeply, becomes shorter with age. Older adults still experience deep sleep, but they move in and out of it more quickly. This means sleep becomes lighter overall, especially in the early morning hours. Because sleep is lighter, the body is more easily disturbed. Small sensations that would not have caused waking at a younger age can now gently pull the body out of sleep. A stiff joint may send a quiet signal to the brain. A full bladder may create mild awareness. Even a simple thought about the next day can be enough to shift the body from rest into alertness. These awakenings are often subtle, not sudden or dramatic. Once the body wakes, even slightly, cortisol naturally steps in. Cortisol is designed to respond to wakefulness. Its role is to support alertness and stability. In older adults, this response can be stronger and faster than before. The body does not always wait to see if sleep will return. Instead, cortisol rises to help the body prepare, even if preparation is not truly needed. This pattern is very common after the age of 60. Many doctors hear the same description from patients again and again. They feel tired, they wake early, and they struggle to fall back asleep. Importantly, this does not mean that something is wrong with the brain. It does not mean that memory is failing or that serious disease is present. It means that the body is adjusting to age-related changes in sleep structure and hormone timing. Understanding this adjustment can be deeply comforting. When seniors stop interpreting early waking as a threat, the nervous system often becomes calmer. Calm signals help lower cortisol, even in the middle of the night. This is why reassurance and education are often as important as any physical technique. The body listens closely to how the mind interprets its signals. In the next part of this journey, it becomes important to look at the hidden triggers that raise cortisol during the night. Many of these triggers are not obvious and often surprise older adults when they learn about them. By identifying these triggers, it becomes easier to gently guide the body back toward longer, more peaceful rest. Hidden cortisol triggers that wake the body at night. Doctors who work closely with older adults often notice the same quiet patterns again and again when it comes to early morning waking. These patterns are not dramatic, and they are rarely discussed during the day, but they strongly influence how cortisol behaves at night. One of the most common triggers is daytime stress that was never released. Stress does not always mean big problems or emotional drama. For seniors, stress can be subtle. It may come from responsibility, caregiving, financial thoughts, health concerns, or simply trying to keep life running smoothly. When stress is carried silently through the day, the body often waits until nighttime to process it. Another important trigger is chronic pain or stiffness. Many older adults live with mild to moderate discomfort in their joints, muscles, or back. During the day, movement and distraction help reduce awareness of this discomfort. At night, when the body becomes still, these sensations become more noticeable. The nervous system interprets persistent discomfort as a signal that something needs attention. In response, cortisol rises gently to increase alertness. This response is protective, but it can interfere with deep, restful sleep. Quiet worrying during the night is another powerful trigger. When the world becomes silent and the lights are low, thoughts often become louder. Seniors may replay conversations, think about family, or worry about the future. These thoughts are often calm on the surface, but the brain still treats them as activity. Cortisol responds to mental activity just as it responds to physical movement. Even gentle thinking can signal the body to remain alert. One of the most overlooked triggers is the fear of not sleeping. After several nights of waking early, many seniors begin to anticipate the moment it will happen again. When the eyes open at 3 in the morning, the mind may immediately think, "Oh no, I'm awake again." That single thought can raise cortisol within seconds. The body interprets fear as a need for readiness. This creates a cycle where fear increases cortisol and cortisol increases wakefulness. The comforting truth is that cortisol is not stubborn or aggressive. Cortisol responds beautifully to calm. When the mind sends signals of safety and reassurance, cortisol levels can soften, even during the night. This means that seniors are not powerless in these moments. Small changes in response can make a meaningful difference. In the next section, we will explore gentle, doctor-approved ways to calm cortisol naturally without medication and without forcing sleep. Gentle ways to calm cortisol without medication. The first and most powerful tool for calming cortisol is reassurance. When you wake up at 3 in the morning, your body is not in danger. It is simply alert. Speaking gently to yourself can change how your nervous system responds. Saying, either out loud or silently, "I am safe. My body is just alert," sends a message of security. The brain listens closely to internal language. Reassuring words reduce the sense of urgency and help cortisol lower naturally. This simple practice works because cortisol is designed to respond to perceived threats. When the mind communicates safety, the body no longer feels the need to stay on high alert. Many seniors are surprised to notice that reassurance alone can soften tension in the chest, shoulders, and stomach. These physical changes are signs that cortisol levels are beginning to settle. The second gentle method is slow, intentional breathing. Breathing is one of the few body functions that directly influences the nervous system. Long, gentle exhales tell the brain that there is no emergency. You do not need to control your breathing forcefully. Simply allow the exhale to be slightly longer than the inhale. This pattern activates the calming branch of the nervous system and reduces cortisol activity. It is helpful to remember that the goal is not to force sleep. The goal is to create calm. When calm increases, sleep often follows naturally. Seniors who focus only on sleeping often feel more pressure, which can raise cortisol. Focusing on calm removes that pressure and allows the body to do what it knows how to do. Daytime habits also play a major role in regulating cortisol. Gentle movement during the day helps the body use cortisol in a healthy way. Walking, stretching, or light exercise sends a message that cortisol has served its purpose. Sunlight exposure during the morning hours helps reset the body clock and supports healthier hormone rhythms. A regular daily routine provides predictability, which the nervous system finds comforting. Many seniors notice improvement not because they sleep perfectly, but because they stop fighting their wakefulness. Changing how you respond to waking up changes the entire experience. Instead of tension and frustration, there is acceptance and patience. This shift reduces cortisol and supports deeper rest over time. Stay with this journey. The next part is especially important for your peace of mind and will help bring everything together in a gentle, hopeful way. What you do not need to worry about when you wake at 3 in the morning. When the body wakes early again and again, it is very natural for the mind to search for frightening explanations. Many seniors quietly worry that waking up at 3 in the morning means something serious is happening inside their brain or body. This fear is understandable, especially when sleep used to come more easily in earlier years. However, doctors are very clear about this issue, and their message is reassuring. Waking up at 3 in the morning does not automatically point to dementia, brain disease, hormone failure, or something going wrong inside you. Dementia is often one of the first fears that enters the mind. Many people believe that changes in sleep mean changes in memory or thinking. In reality, doctors explain that dementia shows itself through clear daytime symptoms, such as confusion, difficulty recognizing familiar people, or problems completing everyday tasks. Nighttime waking alone does not predict dementia. Many older adults who wake early continue to think clearly, remember well, and live independently for many years. Brain disease is another fear that often grows stronger in the quiet hours of the night. When sleep feels broken, the mind may imagine hidden damage. Doctors emphasize that serious brain conditions usually involve ongoing neurological symptoms, not just changes in sleep timing. Waking at 3 in the morning, even frequently, is not a sign that the brain is failing. It is far more commonly related to normal changes in sleep depth and hormone regulation that come with aging. Hormone failure is another concern that can feel overwhelming. Seniors may worry that their bodies are no longer producing what they need to function properly. Cortisol, however, is still being produced. The issue is not failure, but timing. The body is releasing cortisol earlier than it used to. This is a regulation issue, not a breakdown. The system is still working, just differently than before. Perhaps the most painful fear is the belief that something is going wrong and cannot be fixed. This thought alone can increase anxiety and raise cortisol further. Doctors stress that early waking is rarely a sign of irreversible decline. It is usually a sign of a sensitive, alert system that is trying to protect the body. Understanding this can lift a heavy emotional burden and replace fear with patience. For most seniors, waking at 3 in the morning is not an illness. It is a shift in how the body manages rest and alertness. Knowing this allows the mind to relax. When fear decreases, cortisol often follows. Relief begins not with forcing sleep, but with understanding and compassion toward the body. If you have stayed with me until this moment, there is something important to acknowledge. You chose curiosity over fear. Instead of assuming the worst, you allowed yourself to learn how your body works now. That choice matters more than you may realize. Understanding brings calm, and calm supports healing in quiet but powerful ways. You learned that waking up at night is not a personal failure. It is not weakness. It is not proof that you are losing control. It is your body doing its best to protect you, even if the timing feels inconvenient. That effort comes from a place of care, not harm. Seeing your body as an ally instead of an enemy can change how you feel the moment you wake. You are still capable. You are still in control of how you respond. You still have influence over your comfort and well-being. Aging does not remove your ability to adapt. In many ways, it strengthens your wisdom and patience. Even small changes in thought, breathing, and routine can create noticeable comfort over time. Progress does not need to be dramatic to be meaningful. A little more calm, a little less fear, a slightly easier return to rest. These small improvements add up. Each night becomes less of a struggle and more of a gentle pause. You deserve nights that feel safe, even if they are not perfect. Peaceful nights are not about sleeping without interruption. They are about meeting wakefulness with understanding instead of tension. When you allow your body to be alert without judgment, it often relaxes sooner. Trust grows, and with trust comes rest. Thank you for spending this quiet time with me. Choosing to listen and learn is an act of care toward yourself. Tonight, if you wake again, remember this conversation. Remember that your body is not against you. It is responding in the only way it knows how right now. You can meet that response with kindness. You can remind yourself that you are safe. You can breathe slowly and allow the moment to pass without pressure. Sleep often returns when it feels welcome, not forced. If you would like, come back again. We will continue learning gentle ways to support your sleep, your strength, and your independence as the years move forward. You are not alone on this journey. Rest well, take care of yourself, and know that you are doing enough.